So this session is intended to help us give guidance to our cockamamie patients that come in using all kinds of interesting things. So we've been perusing the interweb and plucking off these trends. And so luckily we're joined by two of the world's leaders in cosmetic dermatology. And so they're gonna be able to help us decide what's worth it and what's not. So let's dive right in. How about face taping to prevent wrinkles?
Face taping, well, it's better than mouth taping, which I've seen too, actually.
Although mouth taping helps with weight loss.
It does, but it's not so good with people with reflux. But so face taping actually I first saw it for the treatment of sleep lines. And sleep lines are difficult, and we all have patients that have them, or we have them ourselves. And it ends up, you try to tell the patient to sleep on their back. You try to have them change positions if they're aware of that, or some have tried different pillowcases or pillows. I have seen face taping help in the setting of sleep lines, and that's about it. Not for dynamic lines, and certainly not for photoaging lines.
For face taping, for me, that's a maybe, but mostly a nay. We haven't had as much complaints with the sleep lines, but what we do see tape work well is on the chest lines. So when you talk about the décolletage, especially somebody who's a little bit heavier breasted, and when they sleep on the side, you can see those little vertical lines that come. So that has been helpful, especially if you're using anything like a biostimulatory and then using some type of a drug, energy-based device.
Very cool. All right, so we hear a lot about the red light. I bought a red light. Does red light work? Which one should I get? What are your thoughts on at-home LED mask or red lights?
That's for me is a nay for home. Although it can help, it definitely helps with acne. And if you can get something that's less expensive, I'm okay with that, depending on what the cost is. What I tell our patients, the most effective thing that they can do at home is spend about $7 once a month, and it's on Amazon. You can get a little 0.25 millimeter roller, whichever one is on sale. And then typically, if you pay, I think $5 or $10 extra, we actually just sell it at the office. We can use a little hypochlorous spray so they can clean off the needles. And I have them do that once or twice a week. And if they have any kind of alopecia, androgenic alopecia, I have them do it once a day for at least 5 days a week.
Yeah, yay or nay, I may say may. I mean, masks, nay, red light, yay. And I've done deep dives into this because we get asked this by so many patients, especially recently. And if you go and look, there's a lot of really impressive LED panels that are coming out that are medical grade things, and you don't necessarily need a prescription to use them. Neutrogena tried to do a red light mask for acne, and they launched it at the AAD, I think 4 or 5 years ago, and it kind of flopped. And there are reports of people getting injured on that. They don't follow the instructions. The problem is there's so much variability in what these LEDs can put out. Now, Omnilux is interesting. Omnilux is known for making LED panels, and so I would go with someone who's, who's legitimate in terms of manufacturing. But the masks, there's just too much variability in dosing. I would say if you want to use red light, it is anywhere between 620 to 680 nanometers for things like wound healing and even musculoskeletal. There's some really good data on that. We published a Delphi analysis on this. Is called low-level light therapy, LLT, or photobiomodulation, in the JAD just this past spring. And there's some really good data on the use of red light for those things. So I would consider it.
So I've got one backup comment on that, especially for the scalp. There's a couple of different hair helmets that are out there. There's specific one, there's a 620 combined with a 660 nanometer that shows very, very nice changes. And that's the only one right now that has true data on it. So you can see that it actually increases the production of nitric oxide inside the scalp, which is going to be a prohibitor of conversion of
it's the Revian, right? The Revian, and the only issue is compliance. You got to use it pretty much every day.
Yeah.
Stop looking at me when you're talking about this.
See, this is the before and here's the after right here.
Joe wasn't compliant.
He's non-compliant, he's compliant.
Definitely non-compliant.
All right, how about lymphatic drainage?
Well,
face massage.
Yeah, so lymphatic drainage is used quite a bit by plastic surgeons to help with healing post lifting procedures or any kind of surgery really, that even facelift, abdominoplasties, all those things, because it does help. It does help. I don't know if anybody's had one of those before, but it's a very slow process. I've not seen it be helpful. Just, you have to identify the cause of the swelling, obviously. Some people, and at least where I live, a lot of it's allergic, and so you don't get much benefit.
We use those little gua sha things that during our pollen season, so that's going to be in Houston, it's going to be from March to about May, and that does help, but otherwise I'm a nay. I don't think it does that much.
All right, thoughts about Botox parties? Okay,
There's just silence.
Next slide.
Yeah. Well, I mean, have we been asked to do them? Yes. Have I done them? I typically say nay. I just don't. There's a bunch of reasons for that. I've known, things can go wrong. Doing these procedures outside of your office legally, medical legally, even though Botox typically or any of these neurotoxins is temporary in terms of side effects, you really don't have a lot of protection if you're out there doing something and something goes wrong. And I've seen even filler parties, which is even crazier to me. I say nay and keep it in. It's a quick treatment. Come in the office.
I say nay for two reasons. One, for safety, and number two, financially, it doesn't make any sense. It's better to host something in your office, and we've done it for a couple of different events where we have either a bridal party there or we have a reunion there. So we'll send the limo, they'll pick up the however many people that want to come, and then we do treat there, and then afterwards, if they want, we supply with a little bit of champagne for the car ride home.
All right, so here we go.
Oh, this is a yay for me. Oh, heck yeah. So I think the surgery is remarkable. What's really interesting is, so I know Steve Levine very well, and he had come to a talk that we gave at one of the plastic surgery meeting about 1.5 years ago. And what he said that he did different this year was he actually did introduce some of the energy-based devices. So she used a combination of an ultrasound device as well as an RF microneedling device to improve the overall texture of the skin. She also used a combination of exosomes as well as some of the salmon sperm that we were talking about, polynucleotides.
Yeah, the bigger controversy we were talking about is, do any of the procedures we do in our office, can they hurt anybody's ability to get a facelift down the road? Yeah. And that's a tricky one. I mean, it depends on where you're targeting. I mean, we do know now that these non-invasive devices like microfocused ultrasound, especially, but even more invasive like RF microneedling, can eliminate sub-Q fat in superficial and deep compartments if you're using them at really high energies. Also, and I have had plastic surgery colleagues share videos where they're trying to do a facelift and there's so much adhesion in tissues from some of these biostimulatory fillers like PLLA or calcium hydroxyapatite that they're not recommending those either. So these are things to think about when you're talking to your patients. And it depends on who you ask. I would, for this particular one, I think they're doing these for what, 40, 50,000, these lifts?
This is 200 to 350,000.
200 to 300,000, yeah. Okay.
A little bit more.
And the vectors are slightly different, right? Yeah. They're doing, it's a pure vertical vector, yeah. And they're actually, I think, tacking it to the superficial temporal fascia. There's some different techniques
and to the
here.
Mm-hmm.
And so, and I think that's generally a good thing.
Yeah.
Okay, so these have come and gone, but we get a lot of patients asking if they can put all sorts of different types of hormone preparations on their skin.
Yeah, this one for me is a nay, and I'll tell you why. I mean, we are all in this room here, and this meeting was organized around science and scientific-based evidence. And in the 9 studies that I saw when I was preparing for this talk, only 3 of them were controlled, and they used all different, the estrogen or hormone cream in all different preparations, estrone, estradiol, progesterone. There's no standardization in terms of what creams were used. They didn't even standardize if the patients were menopausal or postmenopausal or whatever the case may be. They didn't look at blood levels. They didn't look at the impact on, say, potentially on endometriosis. They didn't look at any of that stuff. And the endpoints were pretty vague. So it doesn't convince me. And this was pretty popular in the 70s, and I think even Avon was selling estrogen cream back then. And I do know a couple things. I have seen hyperpigmentation induced by the use of estrogen creams, similar to what you might see in melasma. I have not seen any of the other ones like angiomas and stuff induced. It's just not worth it. It's just not there where it needs to be.
For me, it's a nay when you're talking about using any of these products on the face. It hasn't shown anything other than causing acne. Whereas if this is being used appropriately for systemic absorption, I'm at 110% yay. You can see there's long-term effects that occur, and there's several studies that show it increases the thickness of the dermis by using these creams over a long period of time, such as 6 months or longer.
All right, I know we see a lot of weird looking things.
Yeah.
I mean, I always wonder when I see these pictures, is somebody going to tell him he had bad Botox or something, or are they going in and asking for this sort of situation?
Well, Joe, I know that you would never do this, but it's crazy what trends, and because there's these people that are going on, and it's almost a sign of wealth. Back in the day when we were looking at all these breast implants and things like that, people kept getting bigger and bigger. It was almost a show of wealth. So that's the question that's occurring right now. But this is a definite nay for me, and your best friend can be hyaluronidase.
Absolute nay for me as well, and I talked about it just briefly in my talk on Thursday. There is a phenomenon called perception drift, and that is when you see patients and you treat them and they come in for, say for example, for fillers, they come back in however 6 months later, a year later, and they want some more, and then these things can take a decade to dissolve, right? Depending on where you put them, they're not going anywhere, and all you're doing is just adding more and more to them, to the point where it really makes it look unnatural. And who's going to tell them to stop? I think we can. I mean, I hate to say, but I turn away I just won't do it. I mean, anybody else could do it, but I'm just not going to do it. So I don't want to contribute to this phenomenon.
Okay. Tart cherry juice. What sort of data is there to prove or disprove the benefits of tart cherry juice for our sleep and muscle recovery?
Personally, I'd rather just have a glass of wine, like we did last night.
And he did last night.
And I did last night.
And he slept like a baby.
That's right.
I did. So what's the point? Now, I think there is a effect on the tryptophan pathway, which is where this apparently works, and that is what induces the sleep. And apparently they looked at it in patients with sleep apnea. But again, and there's a slide coming up, very little controlled studies on this, and studies that are out there are 9 to 12 patients, 15 patients. So I'd say nay.
Very, very small studies. I'm a nay on this as well. I don't think there's enough data that shows that it does something. And I agree with you with your wine comment. I think that's safer for your heart too, as long as it's a single.
Yes.
Yeah, so Gilly alluded to patients that have had fillers, and he gave the compound name. He talked about Sculptra and also Radiesse. And we put these different agents into people, and then they probably may go somewhere else and get hyaluronic acid. So let's discuss, tell us your thoughts about filler moving around.
I think that's absolutely nonsense unless you're talking about it. I think to me, the most common reason is improperly placed filler, or it's the not ideal product for that location. That's what I see most often. So if you're finding that you're putting a very hydrophilic filler in the tear trough area, if you're talking about putting it in the lips, anything that causes edema, that can be allergies, it can be the use of neuromodulators, can cause more of this type of look that you're seeing here. And so I say that's a nay, unless you're using something that can be pushed up through the muscle. But it's not going to go. We have patients coming in saying, oh, I had filler migration, and you look at the chart and we put something in the temple and they're saying they have a lump down in the nasolabial fold. So that doesn't make any sense to me.
I would say nay, but also yeah, and I'll tell you where. I mean, as you alluded to, any muscle, for example, the orbicularis oculi with the circular motion, it can have a tendency, if the filler is not placed properly, and I like to place mine deep, and I know you do too, to slowly over time migrate the filler down to below the orbital rim. That's the scenario I see this most commonly. And in even some cases, it's accompanied with a Tyndall effect and a ridging. And you just hope that when you see these patients, that it was hyaluronic acid that was used and you can dissolve it, and in some cases it wasn't. And so in that case, I think the migration is EA.
And one of the other things that we're seeing is, especially with this use of PDGF, people are, it's completely, there's not even a label for it. It's still a cosmetic product other than what's being used in orthopedic surgery. And when people are injecting it in the tear trough area, infraorbital area, what we're seeing is long-term hemosiderin deposits, as well as some displacement of something that was put in underneath, especially if it's an HA.
How about diet and skin health?
So this, if you do go with a plant-based diet, you can see there's a systemic decrease of inflammation. Does that mean I give up my steaks and burgers? Absolutely not. But if you're willing to do it, it definitely makes a change. But you do have to watch what your protein intake is, depending on how strict you are with this.
Yeah, I would say yay. I mean, I think obviously there's a lot of phytochemicals in these, and some of which can be sort of sun protective, and some of which can decrease body fat. Obviously, that's a lot of vegans are just lead healthy lifestyles in general, so it's hard to really tell.
How about coming to the office to have your procedure done or buying an at-home device?
At-home devices are like the holy grail, and there has been at least 3 companies that have done at-home laser hair removal devices and even non-ablative fractional devices. And most of them have gone out of business for a reason. I mean, it's not that they're harmful, it's just that they simply don't work. So I would say nay. Right now, I would say nay.
Right now, it's still a nay to me. I think the at-home removal, there's one that's Bella something on Amazon, not on Amazon, at Costco that actually does work, but it's so small, the tip, it's gonna be so much more efficient to come into the office, get a proper treatment that can be in between.
What is this slugging business?
This is a hot mess is what this is. It's a hot mess. If you go to the next slide, we'll talk about one of the methods of slugging now is this beef tallow, which is a really hot mess. And what we're seeing is, does it work? We did this back in the day with Dr. Rosen and Dr. Sue were teaching us that we can use Crisco for those patients who have eczema. And Crisco definitely works. Beef tallow can work, especially on the body. On the face, where people are saying this is going to help with acne, I'm a little bit more skeptical. Sometimes with acne, you are drying the skin out so much, you're going to have more transepidermal water loss. That activates your sebaceous gland to then produce more oil. So yes, it can be a temporary thing, but very, very temporary. I would not, this would be a full nay for me.
I 100% agree, and it's not just in the United States. I have friends in Europe, and actually I have a friend, we both have a friend in South Africa who it's very, very popular. And so, it's just the power of social media. I say nay.
Lots of advertisement for the thread lift, and I know that people, PAs, NPs are doing these in the offices as well as dermatologists and plastic surgeons. What are your thoughts?
So I think threads are a great tool. It depends on where you're putting them, where you're placing them. You have to be in the right plane, and you can see what Adam's talking about here. So one of my buddies is in Miami, and when it's done within a year of the procedure, oftentimes it's not put in the right plane, and you can fish these things out. It does, even though the thread company says there's going to dissolve in about 3 months or so, even lower than that, what you find is there's a residual. What it is 50% of that tensile strength is still there at the 3-month mark. And what happens over time, it's going to be a biostimulatory. So same thing with the PLLA, with your calcium hydroxyapatite, with your energy-based devices. RF microneedling, unless you're really turning up the heat, it's pretty hard to damage something. But with your microfocused ultrasound, I think you do have to be more cautious in terms of when you're putting that energy in based on the facelift. I tell people to avoid those products at least a year before they do their actual rhytidectomy.
I agree, 100%.
Well, we want to thank you for your expertise. Doctors Chilukuri and Munavalli will be with us for a few more hours this afternoon, so please reconnect with them when you have a moment, and we appreciate your insights to help us guide our patients with these wonderful questions they bring into us.
Thanks for having us, Joe.
Thank you.
Thank you very much. Thanks, brother. Thank you. Thanks for having me. Appreciate it.